A vaccine isn't going to change where we're at right now, and case numbers along with hospitalizations are rising across much of the country. More than 4,000 new cases were reported in just 24 hours over the weekend. That is a record high. And today, Quebec reported more than 1,000 cases for a sixth straight day. 5 more people died there. There were more than 1,200 positive tests in Ontario today and 12 more deaths. Nunavut now has its second case. It's connected to the same household where the first case was identified on Friday. In the West, Alberta is reporting 644 new cases and 7 more people have died. In BC, 462 new cases reported in the past 24 hours and 5 more deaths. Apart from Atlantic Canada, the spread of the virus is ramping up fast. Each province is taking a different approach with restrictions, and the messaging can be confusing. We have coverage from across the country tonight, beginning with Mike Drolet in Toronto.
Life is slowly getting back to normal just outside of Toronto in Peel region. With so many people out and about, you'd never know it's the only region in Ontario considered to be in the red zone. Epidemiologists are bewildered.
It's like saying we have speed limits on the highway, but that speed limit is 300 miles per hour. So I think it's far too forgiving of the spread of the disease, and it's not the right timing either. We have a crisis right now. We should be looking at closing things, not allowing things to stay open.
Lockdowns don't appear to be in Premier Doug Ford's playbook anymore. He says he's looking for a happy balance and that he's been bombarded by calls from business owners begging him to keep the province open.
We're the lowest in North America in any jurisdiction, so as much as we're seeing the numbers go up, we still have the lowest numbers for any large jurisdiction.
But on the other side of the ledger is the health argument. Any way you measure it, Ontario is in crisis. 2 days in a row with over 1,200 new cases and a surging 7-day average. And when compared to the worst day the province saw in April, Ontario's numbers have doubled. The stats point to 2 main problem areas: community spread and close contact. Testing hasn't increased, yet Ontario's positive test rate is at an alarming 5%. Politically, expert Meyer Semyatiki says it all adds up to Ford having a credibility problem.
I think it's bewildering why he's going in the direction that he is, and I think until he can explain to Ontarians why that route makes sense, I think it only further undermines his position.
Until then, Ontario is open for business.
I'm Heather Yourex-west in Alberta, where doctors are bracing for an onslaught of COVID-19 patients as the number of new infections continues to surge. Alberta's ICU capacity for COVID patients is already hovering around 50%, but that number is expected to rise.
I'm actually concerned that even the best case scenario involves a real strain on the healthcare system, and failure to get things under control quickly could really magnify that.
A month ago, Alberta was seeing about 250 new infections every day, but in just 4 weeks, that number has tripled, and Alberta's public health system is struggling to cope.
Contact tracing is very overwhelmed in Alberta, and now a lot of the contact tracing is being put on the shoulders of Albertans rather than the contact tracers.
To be blunt, all that we have accomplished together is now at risk.
On Friday, Alberta's premier said the rising case numbers need to be taken seriously, but the province stopped short of implementing any mandatory restrictions.
It's voluntary. This is a strong request that Albertans in Edmonton and Calgary stop holding social gatherings at their homes, that they just keep to their core family group at home, period.
I think if people truly stuck to what is recommended, then I think that we could see a decline, but I think what we're seeing is that that's not being done.
Instead, many on the front lines say it's time for the province to take more drastic action, a short, sharp period of lockdown to give the province's health system a chance to get things back under control.
We are essentially the canary in the coal mine in this kind of a situation, and we are telling the premier that we are concerned, and I don't feel our concerns are being listened to.
I'm Robin Gill in British Columbia, where a second wave of COVID-19 has brought in new restrictions. No gatherings at homes, no fitness classes, limited sports activities.
Over the next 2 weeks, we need to reduce our social contacts, and we need to make sure that we're staying local.
Restaurants in BC were told they're safe spots because so far there is no evidence of COVID-19 transmission.
Nothing changes because In restaurants, it's 6 or fewer people in bubbles that you trust. So they could be a work bubble, they could be a volunteer bubble, they could be your immediate household bubble.
The new rules needed some clarification, though. At first, only members of an immediate household could get together. The messaging changed to include the people you spend the most time with.
This latest action in our COVID-19 response is about putting the brakes on the virus, breaking those chains of transmission. It is a short-term pause on non-essential activities.
The Metro Vancouver area has seen a disturbing and record-breaking spike in cases. Take this modeling done for the BC Centre for Disease Control. It's not a predictor, but shows where things are going. Yellow is the current growth. The other colors show what can happen if there's reduced contact.
If we do something great for 2 weeks, but then we return to what we've been doing in the past 3 weeks, the cases will just pick up again.
BC was the envy of the country at the beginning of this pandemic with its low cases. Not anymore. Robin Gill, Global News, Vancouver.
Manitoba's chief public health officer is considering tougher restrictions because COVID-19 keeps spreading there. Manitoba reported 365 new cases today and 3 more deaths, and the test positivity rate is 9.5%. The bulk of the new cases are in Winnipeg. The province is investigating outbreaks at 2 long-term care homes as well, where 36 residents have died. Hospital ICUs are nearing capacity.
We're at a critical point where we need to change these dynamics. And it all comes down to reducing our contacts.
The Atlantic bubble is holding for the most part. Nova Scotia reported 1 new case today, and it announced a clampdown on travel. Anyone arriving in Nova Scotia from outside the Atlantic travel bubble must now self-isolate for 14 days away from other family members. If that can't be done, then anyone living with that individual must isolate as well, and nobody from that household can go to work or school.